One of the other amazing modalities that we incorporate in our repertoire is called spinal cord stimulator. It's indicated for patients who are suffering from chronic low back pain or cervical neck pain or radicular pain. The way this modality works is basically you are placing the electrical leads into the spinal column, and that electrical leads creates, in layman terms, a traffic jam of pain signals in the spinal column, because all your pain pathways are going up and down through your spinal column, spinal cord, and that's where your pain is perceived. So the idea behind spinal cord stimulation is to cause the neuromodulation of the pain pathways in your spinal column. So instead of feeling painful sensation, let's say a patient is having a post back surgery pain in the back and going down the legs. So instead of feeling that pain, they'll feel a nice tingling massaging sensation that will overshadow their usual pain sensations. So it is a two-step treatment. First step is we do the trial because it's a major invasive procedure. So you want to make sure that patient is going to benefit from it. So trial is basically a first step in the procedure where we have the patient come and place the temporary lead into the spinal column in the areas matching their anatomy where they're having a problem, and leave it out for 7 days. So I tell my patient it's like test driving a car. So if you're going out there and you'll say, well, I want to drive my car for 6, 7 days before I'm 100% sure that I'm going to like it, we just tape it, leave it outside, and then we have the patient come back in 6 to 7 days after the temporary trial. And that's when we ask the patient, okay, how are you feeling? Is there a change in the quality of pain? Is there a change in the severity of pain? Have you reduced your medications? Are you able to do more things? And if the answer to all those questions are yes, then that means the patient qualifies to have a permanent implant. And then a few weeks later, we have the patient come in and do the same procedure, but we implant the battery and leaves everything inside, so nothing is visible. And they just carry a small handheld device, and that controls their intensity, frequency. They can turn it on, turn it off, and it's an amazing modality for our patients.